Are you struggling to find a pathology lab that truly understands your needs? Look no further than Bako Diagnostics. With customized services for today's podiatric clinician, Bako Diagnostics continues their commitment to educational initiatives that propel the profession forward. Bako Diagnostics, more than just a pathology lab, they're your professional partner for podiatric pathology and therapeutics, helping podiatric physicians keep America on its feet.
Hello, everyone. Welcome to Dean's Chat, where we discuss all things podiatric medicine. My name is Dr. Jeffrey Jensen. I'm the Dean of the Arizona College of Podiatric Medicine and the host for the Dean's Chat podcast. Once again, I'm joined by my co-host, Dr. Johanna Richey. Hi, Joe.
Hey, Jeff. How you doing?
I'm doing fabulous. Last week, you said your kids were adapting to the school year. How's that going?
Good. We are in the swing of it. Now what we're really excited about is football season. College football, National Football League. We are a football household. So, and it's great because that's when I get all my work done. So,
I went to the Packer last preseason game the other day at Lambeau Field.
Nice.
And we only stayed about a quarter because none of the starters were playing, but we had a good time. It was awesome. Well, we have a phenomenal episode in store for everyone today. I'd like to welcome Dr. Jake Wynes to Dean's Chat. Welcome, Dr. Wynes.
Hey, how are you guys? Thanks for having me.
Oh, you are welcome. Thank you so much for joining us. Dr. Wynes, we're very informal on Dean's Chat, and if it's okay with you, let's go with first names, Jake, Joe, and Jeff.
Triple J. Great.
You were reading my mind, Triple J. Well, let me do a little more formal introduction at this time. Jake is an associate professor and chief of podiatric services at the University of Maryland School of Medicine. He's the co-director of the Limb Preservation Program. He is the residency director at the Baltimore VA, and he is the fellowship director at the University of Maryland Limb Preservation and Deformity Correction Fellowship.
Sorry, Jeff, I'm the site director for the residency program. I'm not the residency director.
Site director. Okay, excuse me. All right, site director. Let's run with that. I was going to also mention in your spare time, you've been able to put out 26 peer-reviewed articles. You're a frequent lecturer. We'll get into your education in a little bit, but there's no shortage of things for us to talk about today, Jake. We're psyched to have you.
Yeah, that's great. I'm really humbled and honored to be here. I finally made it.
Well, there you go. I was going to say a rising star in our profession, and then I was looking at your CV with all like 40 pages of it, and I thought, no, Jake is a star in the profession. So we're really excited to have you. So tell us about your journey. You've only been out for about 10 years out of your training program, and not many people do 4 years of residency training and a year of fellowship. Super interested in hearing about that. It's just a side note. I've had 4 or 5 people over the last year say, you better get Jake Wynes on Dean's Chat. He's the best. So no pressure, but so share with us your journey, if you don't mind, in podiatry. We're all ears.
Yeah, I really appreciate you guys asking and having me on here to share. When I was born, I'm kidding. It does go back to that a little bit, only because I'm a child of immigrant parents that immigrated here to the U.S. From Kiev, Ukraine, and I was born in Italy on the way. But with that, given the hardship that my parents had, I'll be very genuine and say that I was sort of pushed into medicine in some capacity. Now, why is that? I think medicine's great. I think medicine's cool. Science is definitely very interesting. But, when you have your parents sort of, I want to say, guiding you into this field, you always wonder why. And the fact is that they really wanted job security for me, because in very unsettling times and in the kind of culture and climate that they grew up in, they didn't want any volatility in my life. And in their mind, the best thing to assure that somebody is going to be gainfully employed and have skills for a lifetime would be through medicine. So from there, it really didn't matter what I chose, whether it was any aspect of medicine, not just podiatry. So in keeping with that, I'm also, I guess, a karate geek. I trained many martial arts since I was a kid. And I think I started around 8 years old. And the way martial arts kind of brought me to podiatry is kind of interesting in that, I started at 8, got like this little kitty black belt when I was like 13. And they had me do like karate birthday parties for cheap labor. From there, I started, teaching as an adult, and then all through high school and then into college and stuff. But I had student, his name was Justin, and his dad was a urologist. And it was because of that, then I told him, hey, you know, I'm pre-med, you know, what can I do? So then I spent my summers at University of Maryland doing summer research with a urologist at the time. And I was actually doing research as an undergraduate every summer. I would take the subway, or what we have in Baltimore called the light rail, to work every day. Didn't realize how dangerous the area was, but I would still commute in from the suburbs and go right into Baltimore City. So I've actually been at University of Maryland, which is where I work currently, since 1998. And sort of interesting there that I got mentored by a urologist by name of Toby Chu Chung Chai. That's his middle name, Chu Chung. Toby Chu Chung Chai, who's now, I think, the chairman of urology at Yale. And the other urologist was Dr. Jeff Sklar, who is now one of the big wigs. He was chair of the Department of Urology, University of Maryland, but then went on to do a private practice called Chesapeake Urology. It's one of the largest urology groups in Maryland, maybe even nationally. But with that said, that's where I got my first taste into medicine. And it was actually a time where I was applying to almost everything under the sun. I'd gone through one round of, did the usual, took my MCAT, took my Kaplan review, did my Princeton review, and, fell short to some degree, being a competitive applicant for allopathic medical. Then I decided to try for a graduate degree. So I was able to work in a research lab, got tuition remission, and worked at University of Maryland doing research while I was actually going to graduate school at the time. So I got a master's degree in physiology. And it was while I was working there that the urology residents have to take a mandatory research year. And they are the ones that actually introduced me to podiatry. I literally had no idea. Somebody knew someone that knew someone, and they were like, hey, have you thought about this? And then, at that time I was, back in the application cycle, and I don't want to say disheartened by the process, because, hard to say what should have happened, but the reality was that I took the path of least resistance at that time. My friend's dad was a DPM, shadowed him, usual story that we all go to. I don't think anyone enters this profession without having some exposure. So it was through applying to Chicago Medical School that then I got a letter from Rosalind Franklin, and then interviewed there, and then ended up going to Temple thereafter. And along that, I was still kind of doing the research thing with urology while I was summer breaks and things like that. Even after I got into podiatry school, while working at the Gate Lab too, is kind of double worlds of foot and the other stuff. I actually have, just as a segue to my current status as associate professor, the article that I attribute to bumping my H-index up with the most citations is published in the Gold Journal of Urology, where I was injecting rat bladders with Botox. And actually that's become a treatment for interstitial cystitis and other disorders of the overactive bladder. So it's kind of funny how everything kind of came back to urology. And even so, I was actually, collecting data. I was part of the first ever female sexual dysfunction study with Viagra, where I was collecting data in clinic. There was a lead researcher. Her name was Dr. Jennifer Berman. Her sister was a sex therapist, and they actually had a show on Discovery at the time. And she was on Oprah and all that other stuff. So it was after I got to see like the multifaceted nature of kind of like clinical research that I was kind of like, oh, this is pretty cool. And lo and behold, started with urology and then became podiatry. So that's kind of my story in a nutshell as to how I found podiatry.
Oh, that's fantastic. It's so common, right, to have a friend whose dad's a podiatrist, or you're treated by a podiatrist or a family member. It's classic because to this day, Jake, and we're not talking that many years ago, but students that are coming into podiatry school today just recently learned about podiatry. So it's not like the whole world knows what a podiatric physician is when they're 5 years old, like other specialties, right?
Yeah, I completely agree. And along with that, I'd be remiss if I didn't mention my podiatric mentor. The guy that got me into the profession was Dr. Steve Glubo. He's no longer with us. He ended up passing away of Merkel cell cancer. But I'm kind of going to use this forum as a way to kind of thank him for kind of showing me this profession, and always being just a very nice guy, one of the most genuine individuals I've ever met, allowing me to kind of take the journey and kind of casually mentoring me along the way, but more as like a friendship role rather than like an academic type mentor.
Mentors come in all shapes and sizes and different times in your life, and that's awesome. I mean, you've talked about urologists and your recent mentor, so that's fabulous. So you went to Temple. and spent 4 years there. Then you went to the Penn Presbyterian Medical Center 4-year program. How'd you get there? What was it like? It's a top program. It obviously set you up well.
You know, it's sort of interesting, and I don't know if the climate around podiatry or podiatric medical school is the same these days, but I don't want to say my class was competitive. We're actually pretty cohesive class, and I'm actually very, happy to have been in the class with the class of 2009. I felt like my classmates were wonderful people. I got to really, bond with them quite a bit, but there was this semblance of certain programs that were deemed to be a little bit more competitive than others, and kind of let my grades and my kind of desire to do the best that I can kind of guide me into what I perceive to be a good training opportunity. Fast forward to right now, I couldn't even tell you what a good program is. I think the good program is one for the person that's motivated to seek out all the resources at the program. It could be a touted, well-respected program, but at the same time, if someone's not willing to put in the work, then they get nothing out of it. But at that time, it was less about the place. I think that the pedigree was kind of a neat part of it, knowing that it's affiliated with like a big Ivy League hospital institution. But at the same time, it was mostly my goal was to be surrounded by people that I could consider to be people that I want to be like. And Dr. Scott Millay, Dr. Michael Downey, we had at that time Harold Schoenhaus, and even some younger, more contemporary folks like Steve Shannon, who carries a very not so outward existence, but also Alan Magensky, who was also quite a force back in the day, but it's kind of, and I don't know, I just really value, I give Mike Triano a shout out. So I think those are my top key attendings that were there, and I didn't know anything about that at the time. You go through podiatry school, like you don't know who anybody is. I think a little bit of hero worship, correct me if I'm wrong, is a little bit healthy. And at least it gives you someone to aspire to and somebody to want to emulate and be like. So I felt like at that early stage, I would go there for academics. It was local. I went to Temple, so they had academics there. And I remember there was just a couple of the residents there just totally, blew things out of the water. I mean, they were so enthusiastic and smart and cared. I think it was like that caring of the academic perspective that really drove me to Penn Presbyterian. And I interviewed at plenty of other great places, and just kind of how it shook out with the match. Plus, I got to go with 3 of my other best friends.
Can't beat that.
Who were your co-residents?
A gentleman who's on the APMA Board of Trustees, Dr. William S. Long from South Carolina. Our senior resident was actually Dr. Will Harris, is another great friend of mine. Maria Ugrinich was also a big APMSA person, also a double ACPM liaison. Actually, no, she was a COTH, I think, at the time. But with that said, and then Kim Koreski was the other resident, and then we adopted a young superstar surgeon by the name of Dr. Daniel Perez. He showed up on our doorstep, and we adopted him my 3rd year. So he finished out 2 more years with us. I asked Dr. Magensky if I could take in the stray kitten, and he said, yeah.
That's great. And Joe, what do you think about the current climate? I think it's competitive as ever, and the students are vying for top programs, and you don't accidentally get into a top program and find yourself there and say, oh, how'd I get here? So what's your thoughts on that?
Yeah, I would agree with that, but I can appreciate very much what Jake is saying, and it's actually picking externships and trying to figure out how they want to map out their 4th year. And this has been a conversation that we've been having, that there are perspective, right, looking back, but I agree with Jake that I think that there are now, I don't know what to say is a good program. Like, there are so many excellent programs out there that it may or may not have name recognition to someone, but that doesn't mean that it's not a high quality teaching program. And that I think the things that are, in my experience, the most valuable for students is finding a place where they feel like they will learn in the way that fits their learning style. And you don't know that until you go. You have to figure out what your learning style is. How do you learn a skill, and how do you learn a task? Are you someone that needs to do it multiple times and a lot of repetition? Or are you someone that can see it a couple times, teach someone else to do it, and then you feel good? And it's hard to answer those things about yourself, especially when you're 23 or 24, where some of these students are trying to figure out how to set up their life. And so, we make the joke that it's like dating, you got to go and try this program out. And do you feel like this is a place that you will fit and get what you need from a program, and then also what you want from a program? And I think because Jake and I graduated at the same time, I think when we went through, there was a little more of like, these are the top 10 programs across the country. Those are the ones you go to, right? Like, it was kind of discussed, or at least I felt as a student, it was discussed more that way. And I really don't think that I could give you a top 10. I can't, certainly, but I feel like the culture has shifted, and possibly because the caliber of training has continued to improve, which is good. That's the goal. So I hope that answers your question.
I wonder how many students actually pick for geography also, I don't know. I mean, I wonder if it's, geography versus quality, but how then, like you pointed out, Joe, how do you assess the quality?
And I think this group, this cohort is, the Gen Z, and they are aware more of how they want to do the work that matters to them, but not at the expense of the other things that matter to them. And that is not the mindset that I grew up with. And I don't know, again, I can only speak to myself, but I was the one, you neglect your personal care, you neglect your relationships, you neglect everything, and you do the thing. And that is not how they look at it either. And I think that that's a good thing, by the way. I think, again, it's not to get totally off topic and derail our conversation, but I think that the fact that they are able to start to try to prioritize where their goals are, then they can map out, okay, well, then where would I want to live that will support these other interests or family or the people I'm bringing with me? Where do they want to be? And so, and again, as the training has gotten better across the country, or maybe there are more options across the country, you see great people starting to come out of all kinds of places, that it reinforces this idea that you can go to a lot of different places and still be really successful. And I'll mirror what Jake said, is when I was a faculty at a residency program that would be considered, a top program, we had great people that didn't learn well in our program, and they struggled. And it wasn't because they were bad. They just didn't fit the program, but they probably took it because somebody told them that's the one you know what I mean? And you have to look back and I wonder how that person would have done somewhere else, So I very much think that there's an importance in matching personality to programs, matching what you need, and only the person can ask or answer the what they need part with what they want, and try to figure out how to put all those pieces together.
I agree with you. I also think what you said is very valid. There's so many well-trained doctors. I mean, they talk about coaching trees in the NFL. So many well-trained docs, and they all have mentors. I was impressed, Jake, how they had a tremendous impact on you. And Joe and I have talked about this before. All of our guests seem to have this connection with mentors that have kind of paved the way, or shown them the way, or gave them something to aspire to, as you mentioned before. I think it's cool in a small profession that we can look back and see that. So I know that's happened for all three of us.
I agree. I think lineage is so important too. One of the biggest things I took away from, as the martial arts geekdom kind of peaked, I did, Brazilian Jiu-Jitsu, and, my coach was like a total badass, and his goal and what he wanted was for one day us to beat him. You know what I mean? And I want one day for my trainees to go in there and kick some tail. Like, I want them to kick butt, and I want them to be better than me. And I just, I think lineage is very important, and having pride in that lineage that you've come from, I think, is equally as important. It does kind of amaze me, though, there's still residents out there that have no idea who went to their program even, or who've like paved the way, like the first resident to do a fellowship out of your program. Like, who's that person? And people sometimes don't know.
It takes a while for people to appreciate it sometimes. No doubt. This is a little off topic, Jake, but can you draw some parallels between your martial arts experience and your podiatry training and surgery?
The biggest thing I picked up is there's always somebody bigger and badder. There's always somebody tougher. And one thing is you learn from getting beat up. You learn a much more valuable lesson by getting your tail kicked than you do from winning. And you have to take that and use it as an opportunity. Every time you get on the mat and you get submitted, choked out, knocked out, armbarred or something, intense like that, the more intense the loss, the more learning that occurs, and you're in a controlled setting. Much like the gym where like people aren't really trying to hurt you, they're your friends. Your mentors and your trainees or your trainers or residency directors or attendings or fellowship directors, I mean, they're your friends wanting you to do well. And sometimes they go hard on you to make you do well. And I think that's the biggest thing that I drew from it. I do think in a way, memorizing like what if scenarios, it's almost like chess, like if this happens, then adapt to this. If this happens, adapt to that. Like that's surgery all day. Imagine that stress level is like 9 times out of 10 what goes on. Nothing is ever 100% smooth. And when it is, you're like, that was weird.
What am I missing?
Yeah, exactly. What did I forget?
Waiting for that last shoe to drop.
I should have put the last screw in.
And that is a common theme too. We've found talking to surgeons and training docs, training fellows, trying to get them up to speed so that when something goes wrong, they know what went wrong and how to fix it and keep your head. All of that's so important. I like what you said, though. It's not win and lose. It's win or learn. And that's ideal. And it's a good mindset. Very good. I appreciate that. We like talking about all things that are not always podiatric medicine too.
And then the one thing that was always helpful is, I don't know if you grew up in this culture, Dr. Jensen or Jeff or Joe here, but there'd be like a lot of like resident on resident crime, a lot of like bullying from like other residents. You'd almost be afraid to call on a consult. They'd be like, what's the question? Like, all that stuff.
Yeah.
But you realize that stuff is like it doesn't generalize like the outside world. Like you wouldn't say that to somebody in a parking lot or talk to someone a certain way. So I think that's the other extrapolation I've had from the stuff that I did that was like, I guess like less conventional, whether it be like jujitsu or whatever, but like it just made everything like real at that point, that I knew that this was like kind of like still a real environment, but also somewhat artificial. And I think that really helped me get through, knowing that, you can't take things too personal, things are very stressful, and, adapting to the way people communicate, I think was something else that I realized.
Well said. I went to Kern back in the early 90s, and
that was a good program, right?
It was great at the time, of course. But it was interesting because they would take 6 residents, and oftentimes the 6 residents were from the 6 different colleges of podiatric medicine. So you had all this convergence of people and different ideas and different schooling, and the attendings were phenomenal, and some were easier, some were tougher on you. But I agree, as a learning experience, it's hard to replicate. It really is hard to replicate the residency opportunity. Your thoughts, Joe?
I would love to ask him another question, but I think we'll take a quick break to hear from our sponsors, and then we will come back.
I think that's a great idea. So let's do a shout out to Bako Diagnostics. We all know that early detection is the most important determination in improving patient outcomes. Bako Diagnostics remains committed to you in your role as the first line of defense in diagnosing lower extremity pathologies. Bako Diagnostics, helping podiatric physicians keep America on its feet. We always do a shout out to Jake to Bako Diagnostics. They're a sponsor of our program, and they're so good to our profession. You can't go to a meeting without them being there and helping with the educational process, or sponsoring and training students and residents. So shout out to Bako.
Yeah, I like Bako too, actually. Even though I'm part of the University of Maryland, somehow they let me sneak Bako into my outpatient clinic as part of the faculty physician practices, and the turnaround is great. I mean, this is like no BS. This is just unsolicited. So I've actually, and as far as dermatopathologic evaluation, like you send skin, it like comes back with like a real diagnosis. I'm like, my people, they're like, it's skin. Great, thanks.
That's fabulous. No, I mean, for years, Jake, we had Bako come in a week ago for our dermatology course, and Bill Shear flew in on a Sunday. He picked up the pig's feet. On Monday, he did lectures and biopsy labs, and kudos to Bako. Our students really loved it and appreciated them taking their time and effort to come to help train them too.
All right, so I'll switch to my next question. We'll transition just a little bit, if that's okay, Jeff.
For sure.
So Jake, you are the fellowship director for the program in Maryland. Can you talk a little bit about your own experience in your fellowship, and some of the thought processes in terms of how you look at training a fellow compared to training the residents. What does that experience look like?
I think first and foremost, it's the expectation personally, and I think I can't speak for other fellow directors in the country, but from my own perspective, I'm looking for someone that already has the basic skills that will be able to function as a more, how do I put this, a more predictable, independent fashion. Because in keeping with pivoting and changing your surgical plan and kind of adapting, not that it's about the surgery, but I'd say first and foremost, it is again about establishing that mentorship and that one-on-one communication. You do end up seeing your my fellow, and the fellow will see me more than they see their significant others and their family, and that can be a lot. And it's actually funny, just as an aside. I mean, I feel like right around March and April is when I start talking back. It's really funny. They're picking up my these things that I say, or they start mocking me, or the dirty looks, like that scowl they give you in the operating room. I love it. I always wait for that. And it's different how it manifests with every fellow. I just kind of make a joke about it now. I'm like, oh, it's happening.
We're turning the corner.
Yeah, exactly. No, I mean, I think, health, it's good because you get to have them live the life truly of what it's like to practice. And like, in my case, it's very busy. It's very stressful. We do a lot of life talking, we do a lot of, stuff that you don't get a chance to do as a resident. We get a lot of debriefs. Every case gets a substantial debrief, kind of like what we learned in AO. It's very good to debrief in real time. And as a resident, when they're being pulled and told to go to so many different locations, it can be very challenging to make that happen. But the continuity is just incredible. And I got a lot of that during my own fellowship. I also think personally, the fellowship should be as an added to what you already have experienced. And I'm fortunate that so far, I'm on my big toe on the other foot. So I graduated the pinky toe last year. So I got the big toe on the other foot. His name is Chris Birkelbach. He's actually from Penn, which is great because I kind of know how he was brought up, so to speak. But regardless, I think that it's wonderful to have that ability to give them something that they probably haven't had. And it just amazes me that still they're like, oh, I never saw that. Not like oh my God, this is catastrophic and you're a total hack. But it's like, I'm glad that we're seeing something different. And that, to me, I know that I'm providing some value. Whereas if it was oh, I've already seen this, I've already seen that, oh, my director does this, or I already done that in residency, that would be a tough fellowship, mentor-mentee type of relationship to reconcile. But in my opinion, what I had was deformity correction and external fixation, and I'm bringing a little bit of flavor of that, but adding a little bit more in the chronic wound space and kind of bridging those two. And for whatever it's worth, I think another added value in my fellowship is it's a revision-based program. Sometimes I revise my own stuff, and sometimes it's stuff from the community where I feel, there's a certain value there as well. And, we learn about how to navigate things when things don't go well. And it'd be funny if there was a whole fellowship designed of total disasters, but it depends on the week for me. But overall, I've extrapolated that from my fellowship, and the expectations of my fellow were very high for me, and I have high expectations for my own fellow as well.
So Jake, I have a question for you. I'm looking at your CV, and just in 2 short years, you have 6 wonderful peer-reviewed papers. 4 of them involve Charcot feet, and a lot of authors on it. Have you been able to encourage the fellows to get involved in research with you and be part of that process? And what does that look like exactly?
Yeah, the hardest part with a research study is starting and finishing. And I like to take on starters and finishers. Not every fellow is by nature, without a little encouragement, going to be a starter and finisher, which is where I come in. The middle stuff is easy. I think what we've established is a database that has been compiled and it's updated, and it's the fellow's responsibility to keep the Charcot database running. I think now, especially, and this could just be a rumor, but last I heard that the Journal of Foot and Ankle Surgery is requiring at least a minimum of 30, an N of 30 to publish. Is that true?
I don't know.
Otherwise, it has to go to fast track. I don't know.
I think that might be right. And I should probably know the answer to that. So I'm going to defer to Hero on that one.
Yeah, exactly. But,
phone a friend. I want to phone a friend.
Twofold. One, I want to publish what I'm passionate about. I want to publish what I do the most of, and I want to publish what I have the most thoughts on. And I think for now, it happens to be the most volume with the Charcot and the X-Fixes. So we're kind of sticking to that and trying to, I mean, it's a great topic. I think there just isn't, I mean, there's a lot of preliminary stuff out there, but I feel like the world of people trying to learn more is kind of plateaued a little bit. I mean, there are fixation constructs and things like that, but getting down to predictors of what's going to mess this thing up versus how it's going to sustain. And it still amazes me, and I'm sure we've all had these cases where we do the same thing every time, but still can get a different result. And as long as my limbs are still attached and salvaged, I think that we're still in the game. One thing that I am wondering in the future, and this is a bigger project, I have to get it done before our gait lab person is no longer around. It's actually not at Maryland, it's at Sinai. One of the most brilliant physical therapists with a deformity and gait pathomechanic mind is Anil Bave from Sinai Hospital in Baltimore, Maryland. I think he's the guy's a genius. I have to get after him before he officially retires, but we're going to try to send my Charcot patients to the gait lab and finally see how they walk. And we're going to pick strictly ulcer-free patients. So if they have no wounds and they've had no wounds for, ideally, I'd like to get 5-year plus. I think that'd be great. And I want to see what their gait is like compared to the contralateral limb. And, my assumption is going to be terrible, but I'm very curious to see.
I was thinking 5-year plus means you might be looking for a while to get 30 patients.
Yeah, I mean, it's getting there. I mean, or maybe a year out, like we'll the study, but certainly I think you're actually from my own personal experience. And again, not to derail this to make it totally academic, but I think that 5 years is really the true proof in the pudding. Like if these patients can make it 5 years, I think you're good. It's leading up to all the drama happens like between 1 and 2.
Exactly. No doubt. That's
And
interesting.
I think that's the biggest question mark that's still out there is that 2 to 5, because you're right. There's some stuff starting to emerge, but a lot of it's 1 year, maybe 2, and that's like good follow-up. So very interesting.
And I'm very excited. I'm in a place where nobody wants this stuff. I think Pika scared everyone from doing it, so I'm just getting it. So I don't
That's
know.
interesting.
Probably gonna bite it at some point, but for now it's good.
How cool to have a passion, have the patient population, have the ability to do that research and have a database. Congratulations. That's great. Jake, you brought up earlier H-index. What's your H-index?
It's only 7. That's it. Nothing too crazy. I mean, Armstrong's is probably 1 million, but it's sitting at 7. But my botulinum toxin in the bladder and my pigmented onychomatrosoma, the 4th ever published case, the dermatopathologist worldwide went crazy. I was getting phone calls from like Hopkins. And they're like, "Oh my God, can you tell us more?" I'm like, I can't.
I find it interesting though that you almost apologize for having a 7. 7's awesome. That's incredible. Well done.
No, it was it's a retrocal case, and I was like, Dr. Majensky, is that melanoma? He was like, I don't know. Let's biopsy it.
Very good.
Awesome.
Yeah, no, it's and that's actually like as an aside, we as a profession have to do better of citing each other. I think that's something that we really have to do more of, because we cannot rely on others to cite for us. And I mean, not that it has to be like, like gratuitous, but I think in general, I think we need to be cognizant of that those of us in academic medicine rely on that stuff.
Yeah, absolutely. So Jake, if I said, all right, right now you got to give a 20-minute lecture on a topic, which topic would you talk on? No slides.
Charcot.
Love it.
That's yeah, I've all memorized. No, it's I don't know. I do try to give it a different flavor every time, because I'm always, I am thinking constantly. And I mean, but that's the other thing too. And this is why I want to take this opportunity to get on this platform. And I joked about this earlier, even before we logged on, that I'm not like a one-trick pony. Like I do flat foot, I do lateral ankles. In fact, I've saved limbs, but I've gotten the most cards from doing like a brostrom.
There you go.
But no, I got a good Lapidus game.
What's your Lapidus procedure of choice?
Oh baby, kitchen sink. I actually nicknamed it after my former fellow Corey Dubois. It's called a Duboplasty. Corey and I were just his big thing was like, leave everything on, all the provisional stuff, all the clamps and everything until you're absolutely ready to finish. And sure enough, I mean, that's the trick. We even, in a very fun way, nicknamed one of the provisional fixation pins, which holds it really well. It's like from distal plantar medial to central distal proximal from the first med into the intercomediate cuneiform area. Sometimes that's right exactly where I want to throw my screw, but because I do believe Quasi and his intercuneiform instability, the thing he did with Fleming. But I know you guys had him on the show earlier. You know, Quasi Quadu, another classmate of mine, brilliant guy, love him. I think he was the youngest kid in my class.
He seems like a Doogie Howser. I could see that.
He was the second youngest. Glenn Offcaesar, practices in Florida, was the youngest kid in my class. Actually, at that time, Rutgers University offered your junior year of college, you'd go straight to a DPM school.
Oh,
Really?
Yeah, so that was a program that they had with Temple, which I thought was kind of interesting. So
See,
I don't know.
you know, that's interesting, Jake. I don't want to finish the story, then I'll come back. Go ahead. Finish the story, then I'll come back on that.
Talk about, oh no, just yeah, the pin just hurts because it goes to the abductor. So just avoid the abductor. That's my story.
I like it.
muscle hematoma.
Yeah.
So
I call it Corey's pain pin. Yeah, you kind of never want to be named after. No, I do name my fellows. Like if an implant's named after me, that means it broke off in the foot. But yes, you got a story, Jeff?
I was just going to say, it's great to have those connections with undergraduate institutions, but more and more, they're less likely to want to give up their students to a professional program after 3 years. They want to keep them 4 years. It's hard to get those agreements.
Yeah.
And that's one of the challenges we have. Anyway.
Yeah, I hadn't heard of such a thing, and strictly, you know, anecdotal, because I don't know. I didn't fact check it. I wouldn't.
Makes sense, though. I mean, it does make sense.
They were great. It was two kids in my class that they were, I think, in college together. Dr. Jordan Katz and Dr. Glenn Offcaesar are two great guys. I have to say, I really love my class. I had a really good class.
That's fantastic. So I've written a couple notes here. So you said you used to entertain people at birthday parties with your karate. What's the most outrageous thing you've done with karate?
Fought in combat in the cage in 2005.
Oh, tell us more.
I lost. All my friends came at $35 a head. And I got choked in the first round. And the adrenaline dump was too much for me.
So it was a cage match.
Yeah, before you get too excited, it was amateur. There was shin guards and 7-ounce gloves.
Still,
So,
your buddies paid money to come watch you fight.
I know. And it was so embarrassing because, you know, people that don't know, you know, it's like they like expect you to win. You know, the other thing is, you know, lately, so I got a couple things. I got diagnosed with type 1.5 diabetes. I have latent autoimmune diabetes of adulthood. I have a pump. I've got infusion sets. So all that stuff's done. So I picked up breakdancing, and I was doing a lot of it pre-COVID, and then I stopped. So now the expectation is, much like the other stuff, is like to go out and perform. So every orthopedic work holiday party, they're like these totally alpha, like ortho trauma surgeons, like, we came here to watch you dance. And it's a lot of pressure. I don't know if I'm made for that. So yeah, so that's where we are. You know, jiu-jitsu and MMA are out, and you know, breakdancing, and you know, apparently from what it is, I can get into the Olympics now.
I was just going to say LA 2028. They're waiting for you,
Right.
Jake.
2028.
That's right.
Yeah, I'm actually going to an event this Saturday, and for some reason everyone thinks I'm going to compete. I'm like, no.
Are you going to go be in it, or are you just going to go to watch?
I'm just going to watch. I know people. I'm just going to watch. I love the
That's awesome.
culture. I love the culture. It's great.
Yeah, but
What?
so I would argue, I'm gonna do the thing that I always do. Here comes the golden retriever, right? So the thing that I want to support you in, Jake, is I bet no one else in that room can say they do something interesting like that. And so if they don't have something interesting that might be, you know, their own band of interesting, they don't get a voice. They don't get to make a vote about whether you're good or bad, because they don't do it. It's the Brene Brown. They're not in the arena. They don't get a voice. So I back you up, buddy. You break dance all day long.
Thank you.
I'm looking forward to watching you break dance for sure. So, hey, Jake, I wanted to give you a shout out because Maury North, I have meetings with her every week with the AA. And I know we talked about this a little bit earlier, but she wanted me to say hi to you. And she always, she loved having you being the liaison between APMSA and AACPM. What are your memories of those days?
I felt like I got a lot done, and I felt that as a not plain delegate, but as the APMSA delegate, it just felt, I mean, yeah, it was fun to travel. It was fun to have discussions. It was fun to network and meet students from all over the country. But the liaison positions really made you feel like you had a legitimate seat at the table. And I think it has helped mold me into wanting to pursue more. I think it gave me a glimpse of what's to expect. Correct me if I'm wrong. So you're at the Arizona Midwestern School, correct?
Yep.
Jeffrey Page was the dean at the time.
Correct.
So, I mean, I wouldn't have ever known his name or met him. I met,
Josh
met,
Boone.
well, yeah, Josh Boone.
He was my classmate. He's like a brother.
I just saw him on Wednesday.
Yeah, he's amazing. Like one of the nicest human beings on the
Yes.
planet. Yep.
Yes, and it's because of that, I saw him Wednesday, and we were hanging out. I just, I gave a quick talk at the Baltimore Limb Deformity course, and he was there, and it's just so great to catch up like that. I mean,
Yeah.
it's really amazing. Yeah,
You know-
yes. I mean, it's so fun, but yeah, you get to meet, so, got to sit on the Council of Deans, and, obviously I got to meet and, break bread with Tom Malillo,
Absolutely.
men like that, and, Vince, I mean, everybody. And it really felt like I was contributing, and it felt like I was given an opportunity to kind of see more of the world outside of the lens of a proverbial student. And it was really outstanding. And I do think that these leadership positions, it just helps follow this trajectory, and it helped guide me to do more.
Absolutely. Well, it's funny how those things work, because Dr. Page was the clinical dean at California College when I was a student. And then there you go, Joe.
Oh, that's awesome. I'll tell you a funny story if we have time about Josh later.
One more quick story. So Tom Malillo, his daughter, Jana Kraleski, works with us at Midwestern. So, I mean, talk about a small profession.
Yeah.
There you go. Go ahead, your story.
Oh, so I was just, and I don't think Josh would care if I disclose this on somewhat public broadcasting. He used to write his notes in Korean because it was faster, which I thought was hilarious. Because you look at Josh and you would never expect that Korean would be a language but he would write his notes in Korean. So if we were sitting there and be like, what did they say? I couldn't look at what he wrote down because it was like, so.
Wow.
Yep.
Good thing he wasn't taking notes for the class and copying them and distributing them.
He'd have to
That's what we used to do.
again.
Yeah,
back
exactly.
in the
Like you would pay for a scribe service. Be like, what the hell, Josh?
Come on, Josh.
I'm not paying for this.
That's fabulous. Well, Jake, I have a feeling we're going to have you on more often. We can go in a lot of directions on Dean's Chat, but I mean, we've gone on quite a few in the last 45 minutes or so. Last question for you. When a student comes through and they are contemplating podiatric medicine and they meet you and your fellow and residents, what do you tell them about the profession? How do you set the stage for them trying to learn the most about it?
Ask me that one more time, sorry.
Well, how do you set the stage when a student is inquiring about podiatric medicine? What do you tell them?
It's interesting. I think that it's a career that you can go in several different ways. I tell them, yes, there is the advertisement of the work-life balance, but I do strongly believe that if you want to be a busy, well-rounded, and kind of full service doctor of podiatric medicine, then I don't believe that there is true work-life balance except for the balance that you make within your work. The career itself doesn't really offer that to everybody if you want to be successful, in my opinion. That might be debated. I'm sure there's plenty of people that can do the 9 to 3 and are probably very happy and very successful in their own right. And I think that's wonderful. But for those that I know and the experiences that I've had personally, I know it's kind of a tangent to what you had asked about how do I tell them about the profession, but I do tell them that there's opportunity here. And I do think that there's a wealth of opportunity that spans much more beyond just learning about the foot and ankle and its problems. It really does give you the opportunity to be a doctor of the body that focuses on the foot and ankle. And I think that's the message that I always try to convey as best I can. And granted, I mean, I think that obviously there's a focus, but to be honest, I mean, nowadays there's a literally like anticoagulation therapy that didn't exist, that I've never heard of before. And I'm like becoming that guy or girl. Like it's fascinating. So it's hard to keep up with everything, but you can, and you can use that stuff every day if you wanted to.
That's so true. And John Steinberg said, hey, if you want to work in an academic health center, he didn't say like Jake Wynes, but kind of what you're doing. You can work 16 to 20 hours a day if you want, but you don't have to do that. I think that's important to know. The profession offers you options, which I think options are a good thing.
I did also, as I was going through this, and I apologize, and I just wanted to give a public shout out to my fellowship mentor as well, Dr. Brad Lamb. I'd mentioned almost everyone else that I trained under, but that too kind of guided me in a little bit of my career trajectory and offered me opportunities. And I think it's allowing you to be part of that lineup and to get out there to bat, I think is important. And a true mentor is someone that does offer you those opportunities too. And that's something else that I think, in looping back the whole what a fellowship provides, is offering your fellow the opportunities that you once had to allow them to succeed. Because again, if they don't have a place to do that, then I think the talent can be wasted.
Well said. Joe, last comments?
No, I think that's a beauty. Like there's nothing to follow that.
I agree. Well, Jake, we so appreciate you carving out time in your busy schedule. When we put this up on the website, we're going to put it under residencies, student experience. We'll put it under fellowship. I mean, you've covered the whole gamut, and we appreciate you talking about the gamut of podiatric medicine today.
I don't know if this sounds weird. This was a lot more fun than I thought it was going to be. And I really like you both. So thank you.
Well, thank you.
You didn't really think in the back of your mind, were you dreading it or not? What was it?
I've had a day, and I don't know what to expect here. And I mean, you guys are lucky I'm wearing pants.
We don't know that. You didn't have to say it. There's proof.
There you go. Well, thank you, Jake. Thanks for wearing pants too. That's great. I love it. So all of our listeners out there, if you're listening on Apple Podcasts or Spotify, we'd love a 5-star rating, but also some comments on Apple or Spotify. And if you're watching on YouTube, by all means, become a subscriber. Jake, we are going to have this episode up next week. It's going to be
follow me and forget about it.
What's that?
I need followers, Dr. Jensen.
You need followers?
Where can people reach you?
Yeah, where can we find you, Jake?
At Forget About It.
Oh, that's Forget About It's you. I didn't realize that.
Yeah.
Okay, can we put a link in the show notes?
Yes.
That's fantastic.
Yes, or they can email me.
I'm gonna Google it right now.
But you don't say it like forget about it. You say forget about it or something
Forget
like that.
about it.
Yeah, there you go. I like that. All right. Well, something tells me that Dr. Wynes is not hard to get a hold of. And I think the students and the residents and podiatric community is going to love the episode that we shot today. So thanks so much, Jake. And we're going to send you one of these cups. It's a Dean's Chat cup. I don't know if you like coffee or whatever you drink in the morning or even in the evening. I mean, it'll handle it.
I need it. Thank you.
You're so welcome. All right, everybody. Until next week. Cheers.